Hello everyone, today's topic is on posterior triangle of the neck. Posterior triangle, it is a triangular space on the side of the neck behind sternocleidomastoid muscle. So here is the side of the neck where all superficial structures are removed like skin, superficial fascia and its contents, deep fascia, all are removed to show the muscles forming the boundaries of posterior triangle. So this one is sternocleidomastoid muscle. So we can see the sternocleidomastoid obliquely running from sternum and clavicle towards the mastoid process. This is the mastoid process. So this triangle, it is anteriorly bounded by sternocleidomastoid and its apex is directed upwards, backwards towards the mastoid process. So here is the apex and base is downwards towards the clavicle. So let's talk about the boundaries of posterior triangle. Anteriorly, it is bounded by posterior border of sternocleidomastoid. So we can see here, anteriorly it is formed by the posterior border of sternocleidomastoid and posteriorly it is by the trapezius muscle. So the most superficial muscle on back of the neck is the trapezius muscle. So posteriorly, anterior border of trapezius bounds the posterior triangle and inferiorly, that is the base, is formed by the superior aspect of middle third of the clavicle. So the clavicle we can divide into three parts. This is first 1/3, this is middle 1/3 and here is the lateral 1/3. So only the middle 1/3 of the clavicle takes part in the formation of base. And superior is formed by the apex and apex is formed by meeting point of sternocleidomastoid and trapezius muscles at the superior nuchal line of occipital bone. So here we can see a line which gives origin to muscles. This is the superior nuchal line. So along with the superior nuchal line, we can see the meeting point of sternocleidomastoid and trapezius forming the apex of posterior triangle of neck. So that was about the boundaries. Next we shall move with the roof. Roof, it is formed by the investing layer of deep cervical fascia which is stretching between the sternocleidomastoid and trapezius muscle. So here we can see a white colored structure which is pierced by several cutaneous nerves, which is nothing but deep cervical fascia. Which stretches between sternocleidomastoid and trapezius. This is sternocleidomastoid muscle and we can see the trapezius as well. So the superficial fascia overlying the roof contains a muscle called as platysma. So what you are seeing here is the deep fascia. So superficial to the deep fascia is superficial fascia. So here in this image we can see the muscle called platysma, which is a facial muscles of facial expression present in the neck and which lies within the superficial fascia, and we can see the platysma covers partially the posterior triangle. It forms a part of posterior triangle of neck. Let's talk about the structures piercing the roof of posterior triangle. So first we shall see the external jugular vein. External jugular vein, we can see it pierces the deep fascia to become superficial and it begins just below the angle of mandible. So here is the angle of mandible. We can see in the other image, external jugular vein is here and it begins just below the angle of mandible and it runs downwards and little posteriorly, that is backwards, crossing the sternocleidomastoid obliquely under the cover of platysma. So we can see crosses sternocleidomastoid muscle, and we can see finally it drains down into subclavian vein. So below it drains into subclavian vein. Let's see the cutaneous branches which pierces the deep fascia of posterior triangle. So the four cutaneous branches of cervical plexus are lesser occipital nerve. Here is the lesser occipital nerve. So lesser occipital nerve is, as we know, they are all the branches of cervical plexus. It bears the root value as C2. And next is the greater auricular nerve. Greater auricular nerve is this one. The root value of greater auricular nerve is C2, C3. Next is the transverse cervical nerve. So lesser occipital, greater auricular, they are ascending upwards. Transverse cervical nerve runs transversely in the neck. So transverse cervical nerve has the root value as again C2, C3, same as greater auricular nerve. And we can see the nerves which are descending down towards the clavicle. They are called as supraclavicular nerves. So all these are supraclavicular nerves which are descending downwards. Supraclavicular nerves bears the root value as C3, C4. So these are the cutaneous nerves which pierce the roof of the posterior triangle. So all these nerves, if you see, they pierce the almost near the posterior border of sternocleidomastoid. So somewhere in the middle of the posterior border of the sternocleidomastoid, at this point we can see most of the cutaneous nerves, they pierce the roof and become superficial. So that was about the roof and contents of roof. Next we shall move with the floor of posterior triangle. So the floor of posterior triangle is muscular and it is formed from above downwards as semispinalis capitis, splenius capitis, levator scapulae and scalenus medius. So I will show. So this is splenius capitis. Next one is the levator scapulae. The obliquely running muscle towards the scapula is levator scapulae. And the fourth muscle is scalenus medius. Semispinalis capitis, it is usually not that well appreciated in the posterior triangle. It is partially seen in some and it is well appreciated from posterior view of the neck. So here we can see semispinalis capitis. So this is the posterior view of the neck where the superficial muscle, this side is the trapezius. And here is the levator scapulae. So after removing the trapezius, the other side is shown. So this is levator scapulae. and we can see the cut part of trapezius as well. And here is the semispinalis capitis, which is a little part of it may be appreciated in the posterior triangle as the floor of posterior triangle. The muscular floor of posterior triangle is covered by a layer of deep cervical fascia, which is called as prevertebral layer. So here in this image we can see, after removing the contents and superficial fascia, the prevertebral layer is present, which is like a facial carpet, which covers all the structures forming the floor of posterior triangle. And this prevertebral layer of deep cervical fascia, it forms a sheath, that is the axillary sheath, around the subclavian artery and brachial plexus, and traveling from the root of the neck to the upper limb. So that was about the prevertebral fascia, which also takes part in the formation of floor. And posterior triangle, it is further divided into two triangles, because the lower part of the posterior triangle, it is crossed by a muscle called as inferior belly of omohyoid. So here we know, so we can see the sternocleidomastoid, this side is the trapezius, and we can see the muscles forming the floor, that is splenius capitis, levator scapulae, scalenus medius muscle and all. And this muscle which is crossing here, dividing the posterior triangles into two more triangles, this one is called as inferior belly of omohyoid. So that was about the division of the triangles. So the prevertebral layer, which was I am saying earlier, which forms the floor of posterior triangle, which forms like a deep facial carpet over the structures forming the floor of posterior triangle. So the pus collected in the posterior triangle deep to its facial carpet forms a trabecular cervical vertebra, may track downwards. So the pus will track downwards downwards and laterally towards the axillary sheath, because we said the prevertebral fascia continues as the axillary sheath towards the upper limb, covering the subclavian vessels and brachial plexus. So this pus, it drains towards the axillary sheath, along the axillary sheath to the first, they appear in the axilla, the pus will be seen in the axilla and or even in the arm. Subsequently, it drains downwards into the upper part of the arm. So that was about one clinical aspect which is associated with the prevertebral fascia. So next about the divisions, I already said the inferior belly of omohyoid divides the posterior triangle into large upper part called as occipital triangle. So this large upper triangle is the large upper occipital triangle, and a small part which is below the inferior belly of omohyoid is called as supraclavicular triangle or subclavian triangle. Let's see the contents of each triangle further. So in the occipital triangle, so the first content is spinal accessory nerve in the occipital triangle. So in the occipital triangle, that is a triangle which is above the omohyoid, superior belly of omohyoid, the major content is spinal accessory nerve. Spinal accessory nerve is the 11th cranial nerve. It meant to supply sternocleidomastoid and trapezius. So we can see the spinal accessory nerve supplying the sternocleidomastoid and trapezius as well. The next is the third and fourth cervical nerves, which provides branches to levator scapulae and trapezius. So trapezius has got dual nerve supply. It is supplied by spinal accessory nerve and also from the cervical nerves from C3, C4. So third nerve is the dorsal scapular nerve. The root value of dorsal scapular nerve is C5, which is a branch of brachial plexus, and dorsal scapular nerve is well appreciated in the posterior triangle of neck, and it is meant to supply dorsal scapular muscles, that is supraspinatus and infraspinatus muscles. Next, about 4 cutaneous branches. Cutaneous branches which saw in the beginning of the session, where they pierce the superficial fascia. So these 4 cutaneous branches, they are all the branches of cervical plexus with the root value of from C2 to C4 and C5 as well. And superficial transverse cervical artery, along with the cervical veins, is also seen as a content. And lastly, the occipital artery. Occipital artery is a branch of external carotid artery. So it is also forms a content of posterior triangle of neck. So these are the contents of occipital triangle of posterior triangle of neck. So occipital triangle is considered to be a carefree triangle because no very major structures are not present in the occipital triangle. So next is about the subclavian triangle or supraclavicular triangle, that is the triangle below the inferior belly of omohyoid, and it corresponds to supraclavicular fossa. So here in this image we can see the sternocleidomastoid is removed, and we can see the cut parts of sternocleidomastoid. This is the proximal attachment which is cut and removed. And we can see the cut part of inferior belly of omohyoid as well. So exposing the contents of subclavian triangle. So subclavian triangle corresponds to supraclavicular fossa, and floor contains the first rib scalenus medius and first slip of serratus anterior muscle. So the floor is not well appreciated, but we can see the contents here. The contents are third part of subclavian artery and also accompanying subclavian vein. So we can see the subclavian artery, third part of subclavian artery, and along with it is subclavian vein, and also the terminal part of external jugular vein. External jugular vein terminates into subclavian vein. So we can see the cut end of external jugular vein which is terminating into subclavian vein, and trunks of brachial plexus. And superficial cervical transverse cutaneous nerves, and also the superficial cervical or transverse arteries, suprascapular arteries and dorsal scapular arteries are also contents of subclavian triangle. Next and most importantly, the lymph nodes, which are called as supraclavicular lymph nodes. We can see these green colored structures here which are present in the supraclavicular triangle or subclavian triangle. So these are the contents. So the most important contents of posterior triangle are third part of subclavian artery, brachial plexus, spinal accessory nerve and lymph nodes on the whole. And all the important contents of posterior triangle lie deep to a facial carpet of floor except the spinal accessory nerve. Spinal accessory nerve lies just underneath the roof. So the spinal accessory nerve is appreciated just underneath the roof. So spinal accessory or 11th cranial nerve. The spinal accessory nerve may be damaged in operations involving removal or biopsy of lymph nodes. So we can see several lymph nodes along the sternocleidomastoid muscle. So we know spinal accessory nerve supplies sternocleidomastoid and trapezius as well. So the spinal accessory nerve may be damaged in operations involving the removal or biopsy of these lymph nodes in the posterior triangle of neck. So the point at the junction of upper middle third of posterior border of sternocleidomastoid, where 4 cutaneous nerves and spinal accessory nerve emerge, it is termed as nerve point of the neck. So this point where we can see the several cutaneous nerves, that is, this is lesser occipital nerve, this is greater auricular nerve, and we can see the transverse cervical nerve, and we can also appreciate supraclavicular nerves. So these are the cutaneous nerves, and along with it we can see the spinal accessory nerve. So they all emerge at a point, and this point is called nerve point of the neck. And in the cervical nerve block, the anesthetic agent is injected at this site. Brachial plexus block. The brachial plexus in the posterior triangle is located below the line extending from the posterior border of sternocleidomastoid, that is at the level of cricoid cartilage. So here is the posterior border, we can see the brachial plexus peeping into the posterior triangle. So these are the trunks of the brachial plexus. So in brachial plexus block, this point is chosen, that is along the posterior border of the sternocleidomastoid, just at the level of cricoid cartilage, where to the midpoint of superior aspect of clavicle. So this is the midpoint of superior aspect of clavicle. So the anywhere in between is the brachial plexus trunk. In this region, the brachial plexus can be blocked by the injection of local anesthetic between the first rib and the skin below the clavicle. So the needle is inserted at the vertebral level, that is at the C6 vertebral level, into an interscalene groove between scalenus anterior and scalenus medius. The interscalene groove is formed between anterior and middle scalene muscles. So using the cricoid cartilage as a landmark, and also the C6 vertebral level and the sternocleidomastoid, so all these 3 things considered as the landmarks to give brachial plexus block. So brachial plexus block is sometimes done to perform the surgical procedures in the upper limb. Next, feeling for the pulsations of subclavian artery. Subclavian artery pulsations can be felt at the root of the neck by pressing behind the clavicle at the posterior border of sternocleidomastoid. The hemorrhage from the arteries of the upper limb can be stopped by pressing the subclavian artery onto the first rib lateral to the lower end of sternocleidomastoid muscle. So the hemorrhage can be stopped or it can be reduced by applying a pressure, that is over the subclavian artery in the subclavian triangle, which lies onto the first rib. So the subclavian artery is pressed against the first rib lateral to the lower end of sternocleidomastoid muscle. So this is the lateral end of sternocleidomastoid. Subclavian artery is located here. The subclavian artery can be blocked in the first rib in the supraclavicular triangle or subclavian triangle. Add image here. Swelling in the posterior triangle. The most common cause of swelling in the posterior triangle is due to enlargement of lymph nodes. The supraclavicular lymph nodes are commonly involved and enlarged in tuberculosis or Hodgkin's lymphoma, and that is the cancer of lymphatic system, and malignant growth of breast, arm and chest. So the left supraclavicular lymph nodes are called as Virchow's lymph nodes, which are commonly involved in metastasis from cancer stomach. So that is the importance of supraclavicular lymph nodes. So not only in cancer stomach, The metastasis can be due to cancer of testis and cancer of other abdominal organs as well. So the biopsy of these lymph nodes is helpful to early diagnosis of distant malignancies. So that is the clinical importance of supraclavicular lymph nodes. So with this we wind up the posterior triangle of neck. I hope I made this topic easier for you. Thank you.